So you can see her left eyelid is just a bit droopier. Hi, beautiful.
Hi.
You look fabulous today, by the way.
You.
So talk to me about what you noticed and kind of your story about what happened.
So I feel like after the talk settled in, that my eyes started to feel like a little uncomfortable. But I noticed that I had like the brow lift, so I feel like it wasn't necessarily like the lifting part. I felt like my left eye just felt more relaxed than the right eye. And so I took some pictures and I felt like maybe like it was my lashes or something. So I wanted to make sure it wasn't that. But it actually felt like more relaxed than the right eye. So I did like some Google searching and I read up that ptosis can happen. It's rare. I was reading between like 1% and 5% of patients who receive talks this happens to. And so I've been told before that my anatomy is very different. And so I assume that's probably why I was one of those unlucky candidates for that. Was super accommodating. She made me feel super comfortable that this was something that could be fixed through eye drops and little talks or whatever. Was it talks in the eyelid?
Exactly.
So, that made me feel super relieved and not worried at all. And I trust her and her education and her training. And so I'm looking forward to moving forward with Jessica.
Thank you so much for trusting the process. And again, like you read up, this is a really rare circumstance that happens. And I'm so sorry that it happened to you, but we can address it and we'll work through it together with the treatments of Upneeq to give that really instant lift of that left eye, and then actually just small little neurotoxin injections on your upper lid, which will help counter this. And is it okay that I just kind of zoom in?
Yeah, absolutely.
To show. So you can see her left eyelid is just a bit droopier, and so this is an eyelid droop that has inadvertently happened because of a neurotoxin injection, but we're going to take care of the side effect for you.
Yay.
Thank you so much.
Thank you.
Great, perfect. So we have the Upneeq drop. This is basically going to give an instant lift to that eye.
Okay.
The way that it works is it basically contracts the little muscle in your upper eyelid, and so it's going to give a direct lift within 15 minutes.
Okay, perfect.
This is a drop that you can use until the neurotoxin kicks in, where I'm actually going to place small little units on above your lash line, and that'll give that final lift in order to treat this adverse effect.
Okay.
And this will get us through to the point you're going to metabolize through the neurotoxin. This is not going to stay for the rest of your life. This typically resolves around 2 to 3 months time. But both of these treatments will get you through to the point where it's not going to be obvious you have anything. Okay. Go ahead and look up. Good. And just one drop. Close your eye. And then look left, look right, look up and down. Keep your eye closed for about 20 seconds.
Okay.
Perfect. Hi everyone, I have my beautiful client Caitlin here, and she has been one of the very rare cases that I've ever had of eyelid ptosis. This is basically where there's a muscle in the upper eye here called the levator palpebrae superioris, and very rarely, in about 2 to 5% of neurotoxin clients, this can kind of spread down, get into that muscle, and cause an issue where the eyelid actually droops. She's been amazing. She just came to me and said, I think something's going on. I explained to her what that side effect is and how we can treat it. So already when you're taking a look at her eyes, you can't see, if you open up, you can't see that this is going on because we've used a drop called Upneeq to treat this instantly. Upneeq works by contracting the little muscle in the upper eyelid to give an instant lift. However, I've explained to Caitlin, this is not a permanent side effect. This does go away as she metabolizes through within the next 2 to 3 months. However, I want to give her a more long-term effect with neurotoxin by actually placing small, teeny little drops on the lash line in the muscle called the superior tarsal muscle, which will actually give a longer lasting lift to counteract this side effect. So she's been super calm, trusts me completely in this process, so thank you for that.
Of course.
But this is a very rare thing that happens, and I'm here to take care of it for you.
Thank you.
You're welcome. So just cleaning her upper lid with alcohol here. Okay, small little pokes. Deep breath in, deep breath in. Good. Deep breath in, deep breath in. Deep breath in and out. Doing great. So about 0.5 units, 3 or 4 injection points. And then at about 2 weeks time, this will fully kick in. Until that point, I'll be having her use Upneeq to temporarily give that lift, but this will address that adverse effect of the eyelid ptosis. You're all set.
Awesome, thank you.
You're